This is Rahul Prasad here, and you are welcome to my channel, that is MediConcepts by Rahul Prasad. Today I will be covering two important topics, that is first the signs, symptoms and the features of patients with type 2 diabetes mellitus, and second is the risk factors which leads to the development of type 2 diabetes. Symptoms and the features of type 2 diabetic patients have majorly been classified into total 5 categories. The first is the osmotic symptoms, second is the infections, third is the microvascular complications, fourth is the macrovascular complications, and the fifth is the associated conditions. Now let us begin with the first, that is the osmotic conditions. Osmotic conditions or the osmotic symptoms of patients with type 2 diabetes mainly consist or include 3 P's. The first P is the polyuria, that is increased urge for urination. Second P is the polydipsia, that is increased thirst. Third P is the polyphagia, that is increased hunger. Besides this, the patient also suffer with blurred vision and fatigue. The infections could be of two types, that is the bacterial infections like urinary tract infections and the fungal infections like genital candidiasis. The microvascular complications may include the retinopathy, neuropathy and nephropathy. The macrovascular complications like coronary artery disease with examples of angina pectoris or acute myocardial infarction. The peripheral vascular disease like the intermittent claudication and the cerebrovascular disease like the transient ischemic episodes is also included. Various risk factors which is responsible for the development of type 2 diabetes include the affected first degree relative, that is the parent or the sibling. The ethnicity, that is the high risk population, is also a risk factor. Thirdly, the age, that is the middle age to elderly people are also prone or susceptible to type 2 diabetes. The glucose intolerance also is a risk factor for the development of type 2 diabetes. Obesity, especially the central or the visceral obesity, is also a risk factor for type 2 diabetes. The sedentary lifestyle, that is the physical inactivity or the limited mobility, is also a risk factor. Besides this, the cigarette smoking or alcohol consumption in any form is also a risk factor for the development of type 2 diabetes. Besides this, the other symptoms or the features of metabolic syndrome or the insulin resistance syndrome, which includes either hypertriglyceridemia, hyperinsulinemia, low levels of HDL cholesterol, essential hypertension, etc., is also an important feature, and these pose as the risk factor for the development of type 2 diabetes. Moreover, the treatment with the diabetogenic drugs like the thiazide diuretics, the drugs like the beta adrenergic drugs, as well as the drugs which is like the synthetic corticosteroids, they also play an important role in the development of type 2 diabetes because they are responsible for the production or the decline in the endogenous insulin secretion and also responsible for the insulin resistance to certain extent. These risk factors, there could be certain endocrinopathies which also pose as a risk factor for the development of type 2 diabetes. The pathological chronic hypersecretion of certain hormones which antagonize the action of insulin, also called as the counter-regulatory hormones, are frequently associated with the development of type 2 diabetes and glucose intolerance. The example could be the Cushing syndrome, wherein there is a hypersecretion of ACTH, that is adrenocorticotropic hormone. Besides this, there is another example called as the Cone syndrome, wherein there is a hypersecretion of aldosterone. There could be certain genetic disorders or the syndromes which is frequently associated with the development of type 2 diabetes, which is characterized by the chromosomal defects. The examples could be the Down syndrome, the Prader-Willi syndrome, wherein there is a trisomy of chromosome 21 and trisomy of chromosome 15. Certain type of neurodegenerative diseases like the myotonic dystrophy, which is basically an autosomal disorder which arises from the expansion of the trinucleotide repeat on the chromosome 19. Besides this, the another example could be the Friedreich's ataxia, which is basically an autosomal recessive disorder. These genetic syndromes, there could be the mitochondrial syndromes, which is characterized by the abnormalities in the mitochondrial DNA. For example, the Wolfram syndrome, which is basically a rare autosomal neurodegenerative syndrome which comprises of the diabetes insipidus, diabetes mellitus with the tendency to ketosis, optic atrophy and deafness, wherein the patient's death normally happens in the 3rd to 5th decade. The second example could be the maternally inherited diabetes, which comprises of the syndrome and has the characteristics like the myopathy, encephalopathy, lactic acidosis and the stroke-like episodes. After having spoken about the major risk factors for the development of type 2 diabetes, there itself remains an important risk factor called as the fetal origin hypothesis. Now this fetal origin hypothesis challenges the more established but unproven hypothesis which was suggested by J.V. Neal. It is also called as the thrifty gene hypothesis. The fetal origin hypothesis was suggested by David Barker and his colleagues, which says that there is a relative intrauterine malnutrition which leads to a metabolic programming with a reduced complement of the beta cell function as well as the insulin resistance in the skeletal muscles. If there is a development of obesity in the adulthood, there is a additional risk factor, and the cardiovascular risk factor associated like the hypertension also is associated with the low birth weight. Thanks for watching the video. Have a great day ahead.